Hello and welcome. You're watching Good Morning India. I'm Gargi Rawat. Our top story, the COVID situation in the country and cases of Omicron so far. 606 cases of the new variant of coronavirus, Omicron, have been found in the country. The number of cases in India has doubled since yesterday and has spread in 19 states. Maharashtra has the highest number at 167, while the national capital, Delhi, has 142. Night curfew is now in place in the national capital since yesterday, since Monday, and in several states as well. But the big question now is whether the yellow alert will kick in, as the positivity rate has been high for 2 days now. Delhi's positivity rate is 0.68%.
In just the last 24 hours, 63 cases of the highly transmissible Omicron variant of COVID have been detected in Delhi. In fact, as many as 331 COVID cases have been detected in the last 24 hours, the highest since the 2nd of June. With the test positivity rate hitting 0.68, a yellow alert has been automatically triggered in the national capital, which goes into night curfew from tonight. There is also a worrying jump in the number of patients in home isolation. From 243 patients a week ago, there are now 692 in home isolation. As per the Delhi government's daily bulletin, 266 people have been hospitalized in COVID wards. This Commonwealth Games Stadium had become a 550-bedded COVID facility during the second wave. It has now been reactivated.
We have 3 oxygen plants here who can cater up to 200 to 300 patients, and depending on the oxygen requirement, we have additional 1000 D-type cylinders here as a backup, and more than 500 oxygen concentrators also.
It is very important that we do have our home isolation guidelines in place. This is a more transmissible virus, more infective virus, and all the times he should be wearing a mask as well.
With the sharp increase in Omicron cases, the capacity building for a third wave has begun. As you can see, there are preparations being made for oxygen generation as well as storage. But there are other frontiers that cannot be forgotten. Patients in home isolation cannot get left behind. With Shashikant Jha, Meher Pandey for NDTV.
All right, well, let's take a look now at Kerala, and Kerala too will see muted celebrations this New Year's Eve, with the state imposing a night curfew from 10 p.m. to 5 a.m. between December 30th and the 2nd of January. No celebrations will be allowed after 10 p.m. on December 31st in the state, according to these new guidelines. NDTV's Sneha gets us some reactions.
Night curfew is set to begin in Kerala from 30th of December till 2nd of January. And apart from this, there are also other restrictions. Hotels to continue with 50% of seating alone. 31st December, no New Year celebrations after 10 p.m. And the curfew, where night travel restrictions are going to be there, is going to be there all the way till 2nd of January. Let's also talk to some people for their reaction. Joining me right now is Mr. Joy, who owns a mid-scale hotel. Sir, എങ്ങനത്തെ ഒരു റിയാക്ഷനാ ഇവിടെ വരുന്നത് സർ? ഈ കർഫ്യൂവിന്റെ കാര്യത്തിൽ എങ്ങനത്തെ ഒരു റിയാക്ഷനാ സർ?
ബുദ്ധിമുട്ടാണ്. നമുക്ക് 10 മണിക്ക് അടയ്ക്കണമെങ്കിൽ 8:30ക്ക് ക്ലോസ് ചെയ്യേണ്ടി വരും. എങ്കിലേ ബാക്കി സ്റ്റാഫിനെല്ലാം പറഞ്ഞു വിടാൻ പറ്റുള്ളൂ.
So Mr. Joy is saying that it is very difficult, because if you have to shut the hotel by 10 o'clock, then you have to let go of the staff by 8:30. Otherwise, it's not possible. You have to close the hotel by 8:30, and only then the staff can be allowed to go by 10 o'clock. Sir, in night curfew inde കാര്യത്തിൽ നിങ്ങൾക്ക് ഇത് ഇംപാക്ട് ചെയ്യുമോ?
നമുക്ക് പണിക്കാർക്കെല്ലാം വരാൻ ബുദ്ധിമുട്ടാണ്, പോകാനും ബുദ്ധിമുട്ടാണ്. എന്നുവെച്ചാൽ 4 മണിക്കൊക്കെ പണിക്ക് വരുന്നവരുണ്ട് രാവിലെ. അപ്പോൾ അവർക്ക് ബുദ്ധിമുട്ടാണ്. 6 മണിക്ക് വരുമ്പോൾ നമ്മൾ അത്രയും താമസിച്ച് തുറക്കേണ്ടി വരും.
Right. So it is difficult, because some of their staffs, they even start from their homes at 4 o'clock in the morning to be able to reach here right in the morning, and that then becomes a challenge for them if there is a curfew till 5 a.m. Apart from that, similarly, going back is going to be a challenge for several people who perhaps live even outside of Thiruvananthapuram. So all of this being an impact on the ground, and may I just say that not all restaurants, especially the smaller, the mid-scale restaurants, have not really come out of the impact of the COVID pandemic, especially over the last 2 years. With camera person SP Babu, Sneha Koshi for NDTV.
Now, another concern in this rising cases of Omicron and COVID across the country, our elections are due in several states. Now, amid the court's demand that the elections in Uttar Pradesh be pushed back in view of the threat from the highly contagious Omicron strain, the government held a review meeting, and the response has been that vaccinations for coronavirus should be ramped up in these states where elections will be held early next year. This after a review meeting was held yesterday. There should be strict enforcement of COVID-appropriate behavior, and testing should be exponentially accelerated to curb any sort of sudden surge of the virus. Also today, the poll panel team is going to go to Uttar Pradesh to assess preparedness there. The Chief Election Commissioner and other top officers will review the election preparations. Meetings will be held with state officers on the 28th, 29th and 30th. So for 3 days, a team of the Election Commission, including the Chief Election Commissioner, will be in Uttar Pradesh. In other news now, resident doctor groups in Delhi have threatened a complete shutdown of medical services, alleging a brutal police crackdown on their protest against the delay in college allotments after the NEET postgraduate exam. Federation of Residents Doctors Association, which has been spearheading the protest for a month now, said 4,000 of its members ended a sit-in at the Sarojini Nagar police station around midnight on Monday to adhere to the coronavirus night curfew. They said that they had been stopped from marching towards the health ministry's offices earlier in the day. Rahul Gandhi also tweeted about these protests and the police crackdown, saying showering flowers was just PR. In reality, injustice is happening. I'm with COVID warriors against the tyranny of the central government.
रास्ते में हमें डिटेन करके यहाँ सरोजनी नगर पुलिस स्टेशन पे डिटेन किया गया। उसके बाद काफ़ी डिस्कशन के बाद जो है हमने यही डिसाइड किया है कि हम सफदरजंग से अपना प्रोटेस्ट कंटिन्यू रखेंगे। हमारी जब तक डिमांड्स पूरी नहीं हो जाती है, सरकार कोई सेंसिटिविटी दिखा के कोई कॉन्क्रीट स्टेप नहीं लेती है, तब तक हम बैठे हुए हैं सफदरजंग में। सफदरजंग को हम अपना सेंटर बना के वहाँ से अपनी डिमांड्स के लिए प्रोटेस्ट को कंटिन्यू करेंगे। वही बात यहाँ से जाने की, तो काफ़ी डिस्कशन के बाद नाइट कर्फ्यू को ध्यान में रखते हुए हम लोग यहाँ से चले गए हैं सफदरजंग हॉस्पिटल। सभी जो है यहाँ से मार्च किया है सफदरजंग हॉस्पिटल के लिए। अब हम वहाँ से अपने प्रोटेस्ट को कंटिन्यू करेंगे।
Sure, you can hear and you can see there is a lot of anger amongst the doctors here. We are actually at the Sarojini Nagar police station where around 4,000 resident doctors have been detained. They were marching towards the health minister's residence because this afternoon at the Safdarjung hospital, they say many of their protesting doctors were manhandled. There were orders of lathi charge as well, and women doctors say they were manhandled by male police officers. So today here they are all some have detained themselves voluntarily, and some are here who have presented themselves to detention voluntarily. I am actually here with the president of the RDA, the Resident Doctors Association at Safdarjung Hospital. So we will try to understand from them like what the problem is exactly.
What is the question? Can you please repeat that? What is your question?
Could you explain what the protest is about?
Actually, the protest has been ongoing since almost a month now. The protest is regarding the continuous postponement and delay in NEET PG counselling. We have been protesting peacefully since a month, and we have been carrying out the protest in variable phases and on the verbal assurance of Honorable Health Minister and keeping the patient care in mind. We had taken back our protest in between also. But we have been sitting at Nirman Bhavan for almost 7 days in a row, and this is the 10th day of our boycotting of all the emergencies, and it has been a pan-India protest, and the behavior the Delhi police has shown us, and they have mercilessly thrashed the female resident doctors on road, and this was unprovoked, and I don't know what led them to do so, and they were completely brutal and they were completely shameless. The way they were dragging the female doctors on the road, and they were being malhandled by the male policemen. So this is completely shameless, and I am completely speechless how to describe such kind of disgraceful event.
Right. So today they're calling this a black day in the medical fraternity. They are completely angry with how this has been handled, as I'm sure you can see here as well.
In other news now, controversial perfume trader Piyush Jain was sent to judicial custody for 14 days. This after raids on his premises over the last couple of days found an astonishing 200 crores stored there.
The biggest ever cash seizure in India. over 260 crore, and customs officials are still counting at the house of Kanpur businessman Piyush Jain, who supplies perfume to pan masala manufacturers. What has already been seized in cash is equal to the 2021 budgetary allocation for women self-help groups in rural Uttar Pradesh. After 6 days of raids, Piyush Jain has been arrested for tax evasion. Well, the GST's intelligence unit, acting on input of tax evasion, laid a trap for manufacturers of Shikhar Pan Masala. It was Piyush Jain who was caught in the trap.
4-5 दिन से हमारे क्लाइंट को अनावश्यक डिटेन किए हुए हैं और उसको प्रेशर बनाकर आपने स्टेटमेंट दर्ज करा लिए, दबिश डाल दी। जो पैसा है उसके संबंध में जब लीगल प्रोसेस आएगा तो हम अपना पक्ष रखेंगे। अभी ये उनका आरोप है, हम उस आरोप को अपना डिफेंस देंगे जब केस चलेगा।
Piyush Jain, along with his brother Amrish Jain, learned the art of perfume manufacturing from their father, a chemist. The brothers' Odochem Industries flourished after they started selling perfumery compounds for manufacturers of pan masala. They got into trouble because they took payments in cash. In the 6 days of searches, GST officials have seized more than 200 crore unaccounted cash from Piyush Jain's residence and office, 23 kgs of gold, 600 kgs of sandalwood oil worth 6 crore rupees. As the gold recovered have foreign markings, Department of Revenue Intelligence has also been roped in to probe alleged customs duty violations. With Arvind Gunasekar, Osama Shab for NDTV.
Now let's focus on Chandigarh and the municipal election results. And Aam Aadmi Party in Chandigarh had a big debut in the civic polls. AAP scored big in the polls and toppled the BJP. Here's a report.
The Aam Aadmi Party's big debut, toppling the BJP in 14 of the 35 civic wards in Chandigarh, a city administered by the centre and ruled by the BJP. The Aam Aadmi Party's 31-year-old Damanpreet Singh, a dhaba owner from Chandigarh, beat the sitting mayor Ravikant Sharma of the BJP.
केजरीवाल जी रोल मॉडल लेके आंदे ने ਉਹ ਹੁਣ ਵੋਟ ਅਪੀਲ ਨਹੀਂ ਕਰਦੇ ਸਿਰਫ ਆਪਣਾ ਮਾਡਲ ਪੇਸ਼ ਕਰਦੇ ਨੇ ਔਰ ਜਿਹੜੀ ਸਾਡੀ ਜਿੱਤ ਹੋਈ ਹੈ ਨਾ ਅੱਜ ਜਨਤਾ ਨੂੰ ਪਤਾ ਹੈ ਵੀ ਕਾਂਗਰਸ ਬੀਜੇਪੀ ਉਹਨਾਂ ਕੋ ਕੋਈ ਵਿਕਲਪ ਨਹੀਂ ਸੀ
Among major setbacks, 3 former mayors of the BJP, Ravikant Sharma, Rajesh Kalia and Davesh Modgil, lost the elections, and months before the Punjab polls, the Aam Aadmi Party has termed the party's victory as an indication of change in Punjab.
ਪੰਜਾਬ ਤਾਂ ਪਹਿਲੇ ਹੀ ਮਨ ਬਣਾਈ ਬੈਠਾ ਹੈ ਕਿ ਅਸੀਂ ਇਹ ਰਵਾਇਤੀ ਪਾਰਟੀਆਂ ਤੋਂ ਦੁਖੀ ਹਾਂ। ਸਿਟੀ ਬਿਊਟੀਫੁਲ ਨੇ ਅੱਜ ਇਹ ਸਾਬਤ ਕਰਤਾ ਕਿ ਲੋਕ ਜਿਹੜੇ ਆ ਉਹ ਡਿਵੈਲਪਮੈਂਟ ਦੀ ਰਾਜਨੀਤੀ ਨੂੰ ਪਸੰਦ ਕਰਦੇ ਹਨ।
In the face of the setback in the Chandigarh civic polls, the BJP formally announced its alliance with Shiromani Akali Dal Sanyukt and Amarinder Singh-led Punjab Lok Congress for the Punjab elections.
कि आदरणीय कैप्टन साहब की पार्टी, आदरणीय ढिंडसा साहब की पार्टी और भारतीय जनता पार्टी तीनों मिलकर चुनाव लड़ेंगे। तीनों ही दलों के 2-2 प्रतिनिधियों की एक कमेटी बनाई जाएगी। मैनिफेस्टो, जॉइंट मैनिफेस्टो इन तीनों दलों का हिस्सा गठबंधन का बनेगा।
The civic body results has given a hung house for Chandigarh's municipal corporation, but the debut performance of the Aam Aadmi Party will give them big momentum ahead of the Punjab polls early next year. With Mohammad Ghazali, Vishnu Shom for NDTV.
Welcome back. Aam Aadmi Party's a big debut in the Chandigarh civic polls. AAP's big debut toppling the BJP in 14 of the 35 civic wards in Chandigarh, and this coming ahead of Punjab polls. AAP says this is an indication that people want change.
The Aam Aadmi Party's big debut, toppling the BJP in 14 of the 35 civic wards in Chandigarh, a city administered by the centre and ruled by the BJP. The Aam Aadmi Party's 31-year-old Damanpreet Singh, a dhaba owner from Chandigarh, beat the sitting mayor Ravikant Sharma of the BJP.
केजरीवाल जी रोल मॉडल लेके आंदे ने ਉਹ ਹੁਣ ਵੋਟ ਅਪੀਲ ਨਹੀਂ ਕਰਦੇ ਸਿਰਫ ਆਪਣਾ ਮਾਡਲ ਪੇਸ਼ ਕਰਦੇ ਨੇ ਔਰ ਜਿਹੜੀ ਸਾਡੀ ਜਿੱਤ ਹੋਈ ਹੈ ਨਾ ਅੱਜ ਜਨਤਾ ਨੂੰ ਪਤਾ ਹੈ ਵੀ ਕਾਂਗਰਸ ਬੀਜੇਪੀ ਉਹਨਾਂ ਕੋ ਕੋਈ ਵਿਕਲਪ ਨਹੀਂ ਸੀ
Among major setbacks, 3 former mayors of the BJP, Ravikant Sharma, Rajesh Kalia and Davesh Modgil, lost the elections, and months before the Punjab polls, the Aam Aadmi Party has termed the party's victory as an indication of change in Punjab.
ਪੰਜਾਬ ਤਾਂ ਪਹਿਲੇ ਹੀ ਮਨ ਬਣਾਈ ਬੈਠਾ ਹੈ ਕਿ ਅਸੀਂ ਇਹ ਰਵਾਇਤੀ ਪਾਰਟੀਆਂ ਤੋਂ ਦੁਖੀ ਹਾਂ। ਸਿਟੀ ਬਿਊਟੀਫੁਲ ਨੇ ਅੱਜ ਇਹ ਸਾਬਤ ਕਰਤਾ ਕਿ ਲੋਕ ਜਿਹੜੇ ਆ ਉਹ ਡਿਵੈਲਪਮੈਂਟ ਦੀ ਰਾਜਨੀਤੀ ਨੂੰ ਪਸੰਦ ਕਰਦੇ ਹਨ।
In the face of the setback in the Chandigarh civic polls, the BJP formally announced its alliance with Shiromani Akali Dal Sanyukt and Amarinder Singh-led Punjab Lok Congress for the Punjab elections.
कि आदरणीय कैप्टन साहब की पार्टी, आदरणीय ढींडसा साहब की पार्टी और भारतीय जनता पार्टी तीनों मिलकर चुनाव लड़ेंगे। तीनों ही दलों के दो प्रतिनिधियों की एक कमेटी बनाई जाएगी। मैनिफेस्टो, जॉइंट मैनिफेस्टो इन तीनों दलों का इस गठबंधन का बनेगा।
The civic body results has given a hung house for Chandigarh's municipal corporation, but the debut performance of the Aam Aadmi Party will give them big momentum ahead of the Punjab polls early next year. With Mohammad Ghazali, Vishnu Shom for NDTV.
Welcome back. Well, let's get you the latest on COVID, and the Omicron cases in the country have now gone up to 653. The number of cases has doubled since the day before and has spread now in 19 states. Maharashtra has the highest number with 167, Delhi with 142. Now, night curfew has been called in the national capital since yesterday, since Monday. But the big question is whether the yellow alert will now kick in, as the positivity rate has been high for 2 days now.
In just the last 24 hours, 63 cases of the highly transmissible Omicron variant of COVID have been detected in Delhi. In fact, as many as 331 COVID cases have been detected in the last 24 hours, the highest since the 2nd of June. With the test positivity rate hitting 0.68, a yellow alert has been automatically triggered in the national capital, which goes into night curfew from tonight. There is also a worrying jump in the number of patients in home isolation. From 243 patients a week ago, there are now 692 in home isolation. As per the Delhi government's daily bulletin, 266 people have been hospitalized in COVID wards. This Commonwealth Games Stadium had become a 550-bedded COVID facility during the second wave. It has now been reactivated.
We have 3 oxygen plants here who can cater up to 200 to 300 patients, and depending on the oxygen requirement, we have additional 1000 D-type cylinders here as a backup, and more than 500 oxygen concentrators also.
It is very important that we do have our home isolation guidelines in place. This is a more transmissible virus, more infective virus, and all the times he should be wearing a mask as well.
With the sharp increase in Omicron cases, the capacity building for a third wave has begun. As you can see, there are preparations being made for oxygen generation as well as storage. But there are other frontiers that cannot be forgotten. Patients in home isolation cannot get left behind. With Shashikant Jha, Meher Pandey for NDTV.
Now, Delhi's daily COVID tally has gone up to 331, so a yellow alert is likely. The Delhi Chief Minister is holding a meeting at noon today, and if the positivity rate remains over 0.5% for 2 consecutive days, a yellow alert under the graded action response plan comes into effect. And with the case positivity rate rising to 0.6%, the yellow alert is likely. So just what is a yellow alert? Well, schools and colleges will be shut down, cinema halls and multiplexes will be shut, metro will run at 50% seating capacity, restaurants too will be at 50% capacity, weddings and funerals, only 20 people will be allowed, spas, gyms, yoga institutes will be shut, stadiums, swimming pools will be closed, salons and beauty parlors will be allowed to operate, and public parks will remain open. Now, Karnataka will be placed under a 7-hour night curfew from today for 10 days amid a rise in cases of the Omicron variant. New Year celebrations at pubs, restaurants and hotels are banned. NDTV Shrija spoke to some Bangaloreans on their reactions.
Amid growing concerns of COVID, the Karnataka government has imposed a 10-day curfew, night curfew, starting today from 10 p.m. till about 5 a.m. Now, as a part of the restrictions, we understand several flyovers, some of the streets that will gather The crowd will also be shut down and surveillance and patrolling will also be increased by Bengaluru police. That apart, we understand the BBMP, the civic body, they have also ramped up the testing from 100 per day at the PHCs to 250 per day. This apart, some of the restrictions also include where restaurants will be allowed with 50% capacity, seating capacity, and also where DJs and parties have been completely banned at open places, pubs and apartment complexes. In Bengaluru, with camera person Kumar, Shrija for NDTV.
Well, to talk more about the COVID situation and the worries over the Omicron variant, we're now joined by Dr. Rahul Pandit, Member National Task Force, Dr. Ramel Tikku, Associate Director, Internal Medicine, Max Super Speciality Hospital, Delhi, and Dr. Vipin Vashish, Director and Consultant, Pediatrician, Mangla Hospital Research Center in Lucknow. Thank you, doctors, for joining us this morning. And Dr. Tikku, I'd like to start with you. It does seem that Delhi will come under the yellow alert. What has your experience been in the last couple of days?
Well, the numbers of Omicron cases are definitely going up. If we look at the COVID numbers, Delhi has had a huge spike. If you compare it to 1st of December, there's a tenfold increase from 0.7% to 0.07% to 0.7%. And yesterday we've had 63 odd Omicron cases. So definitely things are going to get worse before they get better, because that's how it's been. If you look at the entire COVID scene all over the world, in UK, Europe, US, things are going out of hand. US is having more than 2 lakh cases, UK is having around 1 lakh cases. Even in India, though the absolute numbers are much lesser, around 6,000 compared to what we saw 6 months back. But Maharashtra, Delhi, Gujarat, the numbers are going up, and probably because of the Omicron variant. It's increasingly transmissible and has the potential for immune evasion. So that we've seen, because in cases that we're seeing, they've already had the infection or they've been vaccinated. So definitely things are getting worse here, and we need to be vigilant. The government has started all the restrictions, they're ramping up the infrastructure, everything is in place, but we also have to be responsible enough. If you go out, look at the markets, malls, there's so much of crowd, it's difficult to control them. So definitely people have to be responsible, they have to wear a mask, and please don't wear a cloth mask. And half of the people still don't know how to wear a mask properly. I mean, you have to follow the COVID norms. You have to be responsible enough. Otherwise, we are in for trouble. We saw what this COVID virus can do in the second wave. The positives still remain that the disease seems to be mild. You don't need probably that much of hospitalization. Severe disease might not be there, but all variants have the potential to cause severe disease. But we have to be concerned, but we don't have to panic. At the same time, the ones who have not been vaccinated with the second shot should go for it, because vaccination still remains our best bet against the disease. And we might have soon the vaccine coming in for the children, 15 to 18 age group, and then the boosters for the healthcare workers. So things are looking good. But overall, if you look at the figures, especially the Omicron, there's a potential that we might have a spike and it might peak in mid-Jan, Feb, and we might be in trouble again. But we have to be vigilant.
Many doctors are saying that they're expecting the numbers, to go up from mid-Jan, that the huge surge will start. Dr. Rahul Pandit, it does seem inevitable in a sense if we take a look at what's happening in other countries and how their numbers surge suddenly. The US, in fact, reporting over 400,000 cases, though that includes some backlog of cases that have also been counted. But yes, so it does seem inevitable that we are going to see a big surge in mid-January, and we all just have to take care of ourselves, take care of the most vulnerable.
Good morning. I think what everybody is expressing is quite concerning, and it is right as well. What I would like to point out is that currently, as of today, we have the two variants which are probably predominant in the country. The Delta variant, which has been predominant for several months now, and the Omicron, which is emerging. We know that Omicron has eventually replaced Delta in most of the other countries, but currently we could say that we got a Delmicron wave going on. So we have to be, as doctors, as clinicians, we have to be vigilant, because not all cases which are presenting may be actually Omicron cases, and they may have a Delta variant which have infected them, which could possibly increase the hospitalization or the risk of them getting hospitalized. So we need to keep our eyes on the ball very closely. The second thing which we all need to remember is that there has to be a lot of self-restraint. people at large need to understand that government is doing whatever government can do to the best of their ability, but they cannot be behind every citizen to behave appropriately in terms of COVID appropriate behavior. So I think a lot of self-restraint is warranted at this time. Night curfews and whatever restrictions have been put are actually meant to be taken in the right spirit and in the letter of it, and they need to understand that they are meant to protect the citizens and not seen as a deterrent in trying to actually break the law there and try to do things which might not be required right now. So I think self-restraint, double masking, you need to concentrate on your air ventilation strategies in closed spaces specifically, and of course the vaccination drive needs to continue with all the important tick marks to be given to the vaccination in terms of 2 vaccine doses for all children to be vaccinated when it starts on January 3rd, and the additional dose for people who are vulnerable and the healthcare workers. I think all of these things together will make an impact. As far as cases are going, I would just take another 30 seconds. As far as the cases are going to go, I'm sure if it is Omicron, we will also see a significant surge in our cases as the weeks go by. And what is important to understand is that our population dynamics are completely different to the other European countries and the American continent. A large fraction of people, if they get infected, even a small fraction of that number would still mean that our hospitals may actually start filling up. So we need to be aware that our population dynamics are completely different to US and UK. If 10 lakh people get infected in India, and if we say that the test positivity rate the hospitalization rate, beg your pardon, is only 1%, we are still going to see around 10,000 people get admitted in the hospital. And if we say that the mortality is only 0.05%, we'll still see 500 deaths. So I think we need to be aware that even with mild infection, people are getting infected into the hospital and into the ICUs. Majority of them, 99% of them, can be managed at home isolation or COVID isolation centers.
All right, Dr. Vipin Vashisht, what do we know about, Omicron and its impact on children? Because there are reports, anecdotal, that, in South Africa and in the US, in New York, they're seeing a lot of children also being hospitalized with the Omicron variant. Is this only because it's so infective and it spreads so vastly that obviously then, a few children and the percentage just becomes higher, which is what Dr. Rahul Pandit just explained?
Yeah, good morning, everybody. I think it is quite an early days as far as Omicron infection is concerned, and it is difficult to say that pediatric populations are mostly affected. You see, in the US and the South Africa also, initially the younger population were affected, but later on, as the disease progresses, that even the older population, they were involved. And later on, even the higher section of the older and adult population, they were affected. So initially it felt like that pediatric population are getting burnt of the illness, but it is not like that. But as the disease progresses, the more of the adult populations and elderly, those who are more susceptible, they are involved. Another issue with the Omicron is its exponential rise and exponential decline as far as the speed is concerned. It is around 2.5 to 3 times more transmissible than Delta variant. And so within 2 or 3 weeks, suppose if you take the case of South Africa or UK or some other European countries, even within 2 to 3 weeks, it has displaced the Delta variant. And there's an interesting research came out day before yesterday, where they've shown that those who are infected with Omicron, they develop enhanced neutralizing antibodies against Delta variant. So it rapidly pushes the Delta out. It may be good news as far as the whole epidemiology and the whole disease scenario is concerned. But we have to be quite careful because of its increased transmissibility. You see, the virus, what does the virus need? It basically needs transmissibility. It does not bother about whether they are able to cause more severe disease and cause more hospitalization, but the speed and the transmissibility, ability to jump from one person to another. And this is what favors the virus evolution.
Right. Also, the fact that now vaccinations are going to be open for 15 to 18-year-olds. Some parents disappointed. They were hoping from at least 12-year-old that, the vaccinations would be there and we'd cover more of the population. Also, the children would be protected. What is your view on that? What would you say to these parents?
I think our first and foremost priority should be to cover the entire adult and more susceptible population. You see, the currently around 41% of our adult of our entire populations are double vaxxed. So our first priority should be to cover these section of society, the adult and elderly. And if you see, the only one vaccine is allowed to be used in pediatric population, that is Covaxin. And if you see the entire scenario, the Covaxin is not available even for those adults and elderly populations. So our first priority should be the adult section of society and those who are more susceptible. Second, I think we should have followed a staggered approach. We should have first targeted only those children and adolescent age group with comorbidities like diabetes, hypertension, renal disease, and liver disease. Something these are which are who are immunocompromised. So our first priority should be these section of society rather than rolling out immediately. Because you see the pediatric population, the chances of getting hospitalization are very, very less, say around 0.008%. And if you compare with an adult and elderly, they are 3,200 times less likely to get severe disease, hospitalized or died.
All right. So well, different takes there. Thank you so much, doctors, for joining us. And here we are again at the end of this year, talking about the threat of a looming COVID wave.
I think it is 41% full vaccination is not going to help us, especially against Omicron.
All right. Well, thank you so much, doctors, for sparing your time and joining us this morning. And, I guess the message is that everybody has to take responsibility for themselves also and ensure that, they follow the COVID appropriate behavior. And yes, all doctors also talking about the correct masks that are to be worn, as that seems that is what can really protect you from this Omicron variant. Thank you so much for joining us this morning.